Let's get you the other big focus, the top focus for this afternoon on the big story. I'm Seher Zama. This is regarding concerns of the spread, the outbreak of the coronavirus. No longer just restricted to China. Multiple countries across the world which are now on alert. It's been called the coronavirus or the Wuhan virus, as it's commonly called since it's originated in China. In China itself, it has claimed 9 lives. Fatalities so far have only been reported in China. But the list of infected people in China has gone up to 440 as well. The virus that has been detected now in at least 6 countries. A case has also been confirmed in the United States. Let's get in further inputs. This is with respect to preparations on ground in India. Level of preparedness in India. At least 6 airports now have confirmed, as per Civil Aviation Ministry instructions, that the screening process has started, one of them being at the Mumbai airport here as well. Let's go across to our correspondent Neha, getting us those inputs. Neha, this is with respect to what all entails the screening process and the preparations there. What's going on?
Sir, as of now, 7 airports in the country, which are considered to be the major international airports, have had the required facilities to be able to scan passengers who are flying in from China, so that due screening is done. These 7 airports are the major airports in the country, which includes Mumbai, Kolkata, Chennai, Delhi, Cochin, and also at the same time Bengaluru. Now, in these airports, especially the pre-immigration counters, thermal cameras, or what they are called as thermal scanners, have been put, so that these passengers are coming in from China are first scanned to check if they are having the symptoms, if they are having the virus with them. If at all any passenger is found to be carrying the virus, they will be taken to a separate health center inside the airport, wherein necessary treatment or necessary precautionary measures will be done on them. For that, in what the Ministry of Civil Aviation and other airport officials have told us is that in-flight announcements are being done inside the flight itself to tell the passengers that if they are showing any kind of symptoms to have carrying the virus, which definitely relates to having acute respiratory disorders, then they self-declare themselves at the airport, so that due screening can start in from there. They are also being made to ask or fill reports which they are given inside the aircraft. This report will require the necessary medical details of the passenger, and the health staff at the pre-immigration counter is also scanning the passengers to understand if they have the required symptom or no. Now, even at Mumbai airport, from where I'm reporting right now, 2 flights, especially Air China and Air Rwanda, have seen passengers coming in from China, specifically in the past 1 week. We've been told from the airport authorities here that not a single case has been found till now for any passenger carrying the virus. As many as 200 passengers have been scanned till now. So these are the precautionary measures as far as this virus, the scanning of the virus at the airports is concerned. But more importantly, advisories also
But
being
Neha,
issued across the airports.
stay on with us before we go any further ahead discussing those
of course,
preparations. Yes, this is of course with respect to passengers only coming from China right now, who are being screened at across 7 airports here in India. But before we move any further into this discussion, it's also important to understand what is the coronavirus here, what are the symptoms, what causes it, and is there a treatment? Let's go across to Tanima, getting us those inputs. There is mystery surrounding this virus here, Tanima. Please share some details.
That's right. As Neha was also mentioning, that it's primarily originated from China, in Wuhan region specifically. And the fact is that over the past few days, the number of cases have in fact increased tremendously, and which is the reason why now there's an alert in several countries across the globe. As we mentioned, that there are at least 6 countries besides China in which the virus has been detected. So what are we doing about it, and what is it that you need to know? Firstly, the virus transmits between humans to humans, but also it's primarily the source has been animals. So it started, the primary source was animals from which it transmitted to humans, but now because of mutation of the virus, it's also transmitting from one human to another, which is the reason why now there's an alert in airports across the globe. Common symptoms include fever, cough, shortness of breath. Now, these are some of the common symptoms which airport authorities are looking out for. Of course, these can be in a way mixed up with symptoms of common cold, but passengers who are especially traveling back into countries from China or the Wuhan region, they are the ones, if they are identified with these symptoms through thermal scanners, they are being taken aside and screened again. Severe infection can cause pneumonia, acute respiratory problems. Now, the danger of this is where we are talking about the health impact of this virus. Now, that can actually lead to pneumonia and acute respiratory problems, but it doesn't end there. If we go into the following point, severe infection can also lead to kidney failure and even death. As we have in fact been mentioning that there are 9 deaths which have already been reported from China, 440 people infected in that country so far. So it is of course a serious situation which other countries are looking at, as we know that there are meetings being held in several health departments, in different countries across the globe. And this is very important. As we mentioned, there's no vaccine against the virus yet. As we know that there are researchers, especially in Germany, who are working on tests to figure out mutation of the virus, who are also working on whether or not a vaccine can be developed for coronavirus. But for the moment, there's no vaccine, which is why precautionary measures are what all the countries which have started screening are stepping up on.
All right, precautionary measures, including India, have started taking that as well. Tanima, many thanks for getting us those details. Let's throw this open to experts with us this afternoon. We have Dr. Sanjeev Mehta, pulmonologist, I beg your pardon, Dr. V.K. Monga, chairperson of the IMA Hospital Board of India. First to you, Dr. Monga, in trying to understand India's public health emergency infrastructure to be dealing with if we have an outbreak, if at all.
No, I do agree with you that India does not have a very robust public health system to take care of these type of diseases, and once they come in large numbers also. But I think as a precaution, the government has already put in an advisory that people coming from China, especially from Wuhan, where the disease has started, they have to be scanned, they have to be screened, and if required, quarantine has to take place. And this is a major thing, because we have not found any, even a single case in the country. But still, I think government has taken preemptive steps.
Yes.
And we should be able to contain the disease if at all it enters India. And we have to be very careful. The education of the people who are traveling by air, in the plane it has to be announced, then at the airport also precautions have to be taken. Anybody who has had cough and fever in the last 14 days, they have to be properly screened at the airport at the entry level. And then if required, quarantine has to take place, because there is no treatment for this. It is only, a disease occurs, the patient gets hospitalized, due care is given, and all the basic treatments are given. And there is no as such, antiviral medicine for this. For the time being, no vaccine is there. So I think precaution is the best thing. Prevention is the best thing. And if at all there is a case, the spread has to be taken care of. These are the most important things.
Okay. So prevention, and that starts with screening, which is what India has already started across 7 airports, but this is only for passengers coming in from China. Should that list be expanded, because now it is spreading to other countries as well? We would know if there is an update to that. But Dr. Mehta, given that this comes with common flu symptoms, how difficult would it be to recognize a symptom, to detect that a person is suffering from coronavirus then?
Yeah, first of all, thank you very much for inviting me on this very important program and taking this important issue. I'm going to, first of all, to answer your question directly, there is no way that we can make out the difference between one flu-like symptom versus another. I'm going to take you back to the SARS virus. A few years ago, we had the SARS, then we had the MERS. And just looking at the patient, there's no way any of us would know at this time that this is the coronavirus that's come from Wuhan. It could be any virus. What it tells us is that whoever has an infection, we should be careful of. And you rightly said that it could have now gone from China to the areas around. And if a passenger is coming, say, from Korea or from Hong Kong or maybe even Singapore, that person should be at a higher level of awareness, excuse me, and also to be screened in a better way. Now, to the best of my knowledge, we don't even have a specific test for the coronavirus. So it's clearly the history that's extremely important. I would like to take this opportunity to
Okay.
tell you that we should, we are better prepared because of the last two viruses, but any patient who's coughing, whether it is coronavirus or whether it is TB, these people should be given extra precautions. They should mask themselves. They should move away from crowded areas. Remember, they are at risk for themselves and for others around them. So this is a good time to spread very good
Yes.
habits. All this being said, I'm sorry, I'm a little so far reassured that this one is less infectious than the SARS virus, A. B, it has killed less people than before. The percentage of mortality is 2.2%, whereas the SARS virus had a 10% mortality.
Right, okay.
So I think at this moment, we should be very concerned, but probably less than it was for SARS at the moment. It can change any time, so we need to be extremely careful and do
At the
not let
moment.
your
All
guard
right.
down.
So this is with respect
go
to the ratio
aggressively in
what you're
screening and
calculating
isolation.
of fatalities with respect to how many hundreds infected here. So it's perhaps not as dangerous with the mortality rate, but nevertheless, precautions in place. We're getting in breaking inputs. This is regarding the WHO, the World Health Organization now, which is holding an emergency meeting today. And this is to decide whether or not to declare an international public health emergency regarding the coronavirus. Remember, the WHO had done so regarding swine flu, which was, of course, 2009, and it had done so in Ebola as well. These are breaking inputs coming in with the WHO now taking stock of the situation here because of the spread of it with international passengers. Continuous travel is spreading across to other countries here as well. Let's go across back to our guest here with us, Dr. Monga. It's important that a final word, of course, that comes in from the WHO. But let's also go through a list of what's in our hand to do. For us to be careful, for us to be continuously sanitized with respect to our surroundings, our environment, what is it which is in our hands? Of course, we're hoping, expecting that the government would be doing a lot more, but at a personal level here, in our hands, to stay away, perhaps.
Dr. Mehta rightly said that crowded places have to be avoided, number one. Number two, hand hygiene especially. Wash your hands as frequently as possible, especially when you are traveling from one place to another. Next is that, while you are coughing or sneezing, put your hanky or tissue paper on your mouth and nose so that the virus does not spread even if you have it. And I think something which is being said, that non-vegetarians should cook their eggs and meat and other things properly before they consume it. And these are the few steps which can be taken. Hygiene is the most important part, hand hygiene especially, and taking care of your sneezing and your coughing. These are the few steps we have to take.
Yes, more breaking inputs here coming in. This is with respect to a decision now that has been taken by one of the countries, North Korea. And it has taken this extreme step in deciding to ban tourists to North Korea altogether. This, they say, of course, is to protect North Korea and its people against this new virus that has already claimed 9 lives in China, affected 440. So North Korea decides to ban all tourists from China. Breaking inputs here coming in. Dr. Mehta, in your view, given the speed with which the infection is spreading, do you think an aspect of this that needs to be taken into account even by India? Of course, we're screening passengers. We don't believe in such bans such as North Korea. But should we be screening more passengers, not just from China, but now from other countries, other affected countries as well?
Yes, I agree with you. I think we should, because already the spread has gone to other countries in the neighborhood. And as we know from the SARS experience, we could get patients or individuals coming from any of these countries through secondary contact. So it is very good to be aware of this, do the screening. I think what's very important now is we have better measures because of our experience with previous viruses. So our teams are better ready, our hospitals are better ready, and we should do everything because this is just one epidemic. Remember, the viruses are mutating. So next year we could be having an even more serious epidemic. Let this be a lesson for the future. And as Doctor has rightly said, we have to start the hygiene, which in India is lacking. People should not cough in the open. They should not spit in the open. They should wash their hands more often. This bad habit of spitting pan and other things, let this be an opportunity to move us in that direction and keep our guards completely up and be prepared. It can come anytime, it can mutate. So we need to be extremely cautious.
Right. Okay. Going across to my colleague, our correspondent Neha with us, who of course has been getting us those inputs from the Mumbai airport, one of the airports which has been instructed, of course, to screen passengers. Neha, this would of course be a final word that comes in from the Civil Aviation Ministry here, but is there a concern that the screening of passengers, the list of passengers that need to be screened, that needs to widen now?
Sir, as of now, we understand that Mumbai Airport, which, as you mentioned, is the second largest airport of the country, they have informed that they have taken the necessary steps as far as screening of the passengers is concerned. In fact, even in 6 other airports, apart from Mumbai, the scanners have been put in. And by large, till now, at least fortunately, no passenger has been scanned positive of the virus. We understand that the Ministry of Health is in continuous coordination with the Civil Aviation Ministry, and more steps are being taken, if directed by the Health Ministry, to install these scanners at the other airports and take further widened measures to ensure that passengers who get already tested of the virus are ensured that further treatment is given to them at the airport itself, so that the spreading of the virus is contained. But as of now, we understand that the ministry has been positive that all the due process that is required for scanning the passengers are available at the airport.
Right. Dr. Monga, we of course have been established well as... Okay, very quickly, bringing in Dr. Sanjeev Mehta. Yes, you wanted to say something, please.
Yeah, I just wanted to say this, that I think the awareness has to go down to the patient level, that if they ever have symptoms, they should not only seek out the government, but they should reach their doctor and tell them where they came from, so we can be extra careful with them. You see, I have no idea if a patient comes to me what his symptoms, where he came from, and they must tell us so that we can be preemptive, precautionary, we can isolate them and give them the due care that requires. So a lot of onus is on the patient. Remember, we are all depending on the patient and the family. They must be upfront from where they came. Give us all the information so we can help them and the community. Because many times they don't tell, they're scared, they'll get labeled.
Right.
That
So
fear
this
must
is of
go
course a quick word of
about
advice
disclosure.
for
You must
patients
encourage
suffering
them
from
to
even
say.
flu, that if they're going to their doctor, to even inform them, have they traveled to these areas, where they're coming from, what has been their travel itinerary. It's important that doctors be informed here as well, because remember, these are common flu symptoms. It would be difficult to detect even if you are carrying the coronavirus. But Dr. Monga, we have our surveillance system in place. Should our concern here also be as far as upgrading the health system is concerned? That was something that was promised in 2018 in the wake of the Zika virus. Have we seen that improvement on ground? Because no longer it would just be about maintaining a stockpile of medicines. This would also be quarantine measures to take place as well.
Sahar, I mean, we must agree that our government systems move very slowly and they act when there is a disease. I mean, knee-jerk reactions are taking place. But overall, I mean, there should be real good surveillance all through the year for all ailments, especially at the airport, even in public health, you know. Any disease anywhere in the country, there should be good surveillance and action should be taken. But I believe that sometimes the government, state governments or the central governments are lacking in that direction. There is not that enthusiasm and zeal to go ahead with it. and to contain various other diseases, not only this virus, because often every third month, every 6 months, we have some disease being imported from this place and that place. And these type of surveillance should be continuous and very robust, and they should take place every now and then throughout the year. That is the most important part.
All right, so this is something that should continue, even a surveillance that should be continual through the year, not just in special situations, emergency measures such as this. Appreciate you gentlemen being with us and speaking to us here on this. This is special as far as the coronavirus here is concerned, and what's in our hands here, precautionary measures that we should be taking. Of course, basic cleanliness is always the biggest service that you can do to yourself, basic cleanliness and of your surroundings there as well, because remember, there is no vaccine, there is no treatment to this virus yet. Thanks for being with us.